We are back with Dr. Sharon. So much information is coming out, and everyone has got to grab, I'm holding it up, Grown Woman Talk, the guide to getting and staying healthy, because it truly is a book for everyone. There is no age group that should be excluded from this, particularly if you're a woman, because there's so much information in there that's so empowering about the different chronic conditions that we're predisposed to having as Black women, potentially, right? It's not our destiny, but we need to be aware, right? About heart disease, about diabetes, about menopause and perimenopause, all those things. And they're the things that are completely in the dark to us. Like when I'm a millennial, we don't spend a lot of time in my friend group talking about perimenopause. Nope. Forget menopause. Nope. Heart disease. We just live our lives and try to be healthy, right? But we're not really prepared. And then we're not really prepared to have conversations with our doctors. Maybe we make the appointments, which is important. But what do you do when you're in the appointment? And so I want to spend some time talking about, first, I want to talk about what are some tips that you can offer for us to effectively communicate our health needs and what we should be looking at as we age and what we should be guiding our doctor's visits about when we're in our 30s and our 40s and our late 20s.
Right. Well, I spend a lot of time talking about sort of what your expectation should be of a doctor's appointment. And number one, I think that everyone should establish good preventative health habits. You go to the doctor, not just when something's wrong, you go to the doctor because you need to get that, what I call anticipatory guidance. So when you come in to see your doctor and you're just doing your annual exam, you're not just there for a pap smear and and someone listening to your heart and lungs. You want someone to tell you, okay, this is what you need to do this year. These are the things you need. Sometimes it's contraception, sometimes it's preconception counseling, all of those things, but know what you are coming in there for. And it's great. So if you don't have any problems, you leave, you're good, but you know what your marching orders are for the next year. Do I need any vaccines? Do I need any blood work? Do I need any screening tests? Because I have told my story about what my family history is and what my health history is. That's number one. But I think that there is a separate part, and that is where it's really important to be a good storyteller, is when you do have a doctor's appointment and you are going in about a problem. And let me say this, whatever the problem may be it fibroids, be it, endometriosis, be it pain, any of those things that may come up that would drive you to the doctor other than at a time for your annual visit, I say this, make that appointment separate and apart from when you have your annual visit, because they're two separate goals. And the reality is that we're only going to get about 5 to 7 minutes in front of doctor time when you go in for any doctor's visit. And that's unfortunate, but that's how it is. So you've got to learn to be very efficient. So if you're coming in with a problem, this is where you do a little homework in the beginning, because you're going to say, okay, this is what my problem is. And I walk you through all the things and the questions that you need to have very clear in your mind. When did it start? How long does it last? What's the evolution of whatever the problem is? And the reason why that's important is because most conditions that we have, there's an evolution, there's a story, it has a beginning, it has a middle, and then we're trying to figure out, okay, well, how are we going to get the best outcome from it? And so the better storyteller you are, and you can sort of help me connect the dots when you're trying to get your problem resolved, then the better solution I can craft for you. At the very least, I can at least figure out what path will be most productive for both of us to figure out what's going on. But if you come in and you're disjointed and you say, well, and then on Tuesday this happened, and oh, by the way, 2 years ago, and you're off in every direction, it's hard to make sense of that story and to craft it. So I give you all the tips that you need to sort of think ahead, such that when you go in the doctor's office, you've got your 7 minutes, you are loaded for bear. You know what you're in there for. This is what's going on, doctor, and it makes their job easier. And it also makes your outcome better.
I hope y'all are listening because you mentioned a lot of key points. One, you should never leave a doctor's office, even on a preventative annual care visit, without some kind of marching orders. Like, what's the next step? What should I be looking forward to? What should I be watching? Even if everything's good, should I be looking at my cholesterol a little bit? Or should I be doing a screening? Or am I overdue for a vaccine? So, never leave a doctor's office with nothing. So, I heard that, right? Am I capturing that right?
That is quite clear. And you know what else you should have your doctor tell you? Because here's just an interesting data point. I do have a whole chapter in my book about fibroids, and that's a particular problem for Black women. You know, they're very, very common. 80% of Black women at some point in their lives will be diagnosed with fibroids. But 50% of women don't even know that they have fibroids. So you kind of say to yourself, well, how can that be? Well, it's because a lot of times they may not come to clinical diagnosis until they're either really big or you're having bleeding problems. And then, you know, you see a doctor. And let me just say this. This is also important that the reason why you are the most powerful person in this interaction. Suppose you see a different provider every time you go. Your insurance changed. You've gotten a new job or whatever. So I haven't seen you for 10 years in a row. I don't know what the evolution of your story is. Well, this is the story with fibroids. They don't usually just pop up out of the clear blue sky. They may become problematic at some point. Only about, I told you, 80% of Black women have fibroids. Only about 25% of them will actually need some sort of medical intervention, either medical or surgical. But 50% of women didn't even know that they had fibroids. And you kind of go, how could you not know that? Well, because you've had doctor's visits along the way, and you might have had, a doctor might have done your exam and felt something. And it's like, okay, well, that's a little bit larger than normal, but you weren't complaining of anything and they may not have mentioned it. And so, you know, you may think that I had nothing, it was all fine last year. And then now this year I'm seeing a new doctor and now I've got fibroids. They usually didn't just come up in a year. So that's where you ask, even on annual exams, was everything okay? Did you feel anything? Was my uterus enlarged? And at least you have that as a data point. So when you see someone new and they feel this, they know that this didn't come up in 6 months. This has been going on for 2 or 3 years. And that's not necessarily to mean that you have to do anything about it, but you need to know, what are my findings on my exams? When you leave there and your doctors have done blood work for you or ordered tests for you, you should always know what the results of those tests are. Don't ever walk away and say, well, it must be fine. Nobody called me, or you didn't bother to sign up for your patient portal. So you don't know what your test results are. And then you're assuming, well, it must be fine. Somebody will call me. And I'm here to tell you that in today's world, that's not how it works. You have to make the assumption that you're the captain of your own ship here. And don't think that someone's going to always have you. It's great if they do, but they might not. And this is how mistakes are made. So again, this is where I want you to own your power in these interactions, because you're going to keep this such the next time you see someone who may be, who knows, another state, another practice, but you have the sense of your story, the evolution of whatever it is that's been bothering you, or even just the normal findings along the way. That didn't just get here. Okay, well then we know we can tamp down the temperature a little bit here, because it's not an acute problem. It's been going on. And fibroids are just a good example of how that normally happens, and particularly for younger women, very, very, very common, and they don't come out of nowhere. They've usually been there for a while.
I think that's a perfect example because, and it also goes back to, really your team, your medical team is as active or as passive as you make them to be in some ways, right? And owning the power. Now, there's sometimes you just have a terrible, like a mismatch of a provider, or they're just not great. But a lot of times, I think there's something really powerful and relatable what you said, because what will happen is, I know for myself, I have fibroids, and it's like it was like, oh yeah, if I didn't ask, it was kind of like, oh yeah, you do, but it's fine, you're not complaining about pain.
Right.
So then all of a sudden this is my 20s, and then I hit my 30s, and I'm like, this is excruciating. My cycle, but again, I assumed this was normal because, again, I'm not talking about my suffering. I'm assuming everyone has terrible periods. That's normal, right? And all my friends have, it's like this conglomerate of like, yeah, it's just terrible. And it's like, oh yeah, you did have it back then. It just, it was just a small
why
thing.
mention it, right?
Why mention it? Now all of a sudden it's this thing. Same with, and it's important with the blood work piece. You don't get a call, sign up for your patient portal. Find out anyways, because maybe you didn't get a call because the normal's level, but you're 2 points away from high cholesterol. So by time you come in, you ignore it because you didn't get a call. So you ignore it, you go about your life doing the things that you do. Now you have high cholesterol. Now you require a medication. So it does matter to be proactive and, like you said, never leave without something, and be active, because your provider, more times than not, will meet you with the energy you bring into the room.
That is exactly right. And if you're in a hurry to get out of there, they're in a hurry to get out of there.
Yes.
So, then you're going to leave and you're like, well, okay, I checked that off my list. I've been to the doctor. Well, what do you know? And what are your expectations for the coming year? And I don't think that it's unreasonable, because I think that the thing that we don't spend enough time talking about really is prevention. And that is a message that I want to hammer home again and again and again. We can talk about what to do when you get sick, but I want to talk about what you can do to not get sick. Let's work on that part. Because just as I said, genetics is not destiny. Just because these things are out there does not mean that they are in your future, but you need to know how to avoid them. It's just as, that's just as important as figuring out what to do once you're already sick. I think about how many of us suffer unnecessarily because, again, just as I said, no one knows how you feel but you. But if you don't talk about it amongst your friends or amongst, your elders or your older sisters, you think that what's normal is what's normal for you. And this is how I said, as Black women, we normalize suffering. There is a study that was done called the Study of Women Across the Nation. And they followed a group of women for 25 years. And it was a fairly diverse population of women. And they started when they were premenopausal, and just followed them through the process. What does perimenopause look like? What does menopause look like? And they just, again, did surveys. And this is the interesting thing about what they found for Black women, that Black women tended, as they entered into this perimenopausal space, they tended to have more symptoms like hot flashes, mood swings, sleeplessness, all of the things that we associate with menopause. They tended to have them earlier. Their symptoms were more severe, and they lasted longer, than general population. And one of the big things that happens when you're perimenopausal is that you get a lot of sleep disturbance. You're waking up in the middle of the night. And again, we get back to that stress and how this interacts with stress and high blood pressure and weight gain. All of that is tied up into one endless cycle. Well, they found that when they ask Black women, well, how do you sleep? And they're like, fine. And then they actually do the test where they can measure how many times are you interrupted in sleep? How much, what's the quality, not just the length of your sleep, but the quality of the sleep. By objective measures, Black women have more disrupted sleep and sleep fewer hours than the majority population, but we don't report it. You know what I mean? Because again, well, that's normal, right?
Yeah.
That's just how you feel. And I'm supposed to be tired. Chronic fatigue is not a thing. If you are chronically fatigued, then we've got to figure out, again, don't normalize suffering. If there's a message that I can say to you again and again, and that is whether it is about fibroids, whether it's about, what your chronic fatigue level, what your sleep is, don't, because when you do that, you really blunt some very important messages that your body is sending you that you're ignoring. And then if you minimize it, like I said, it all goes back to storytelling, then you don't even bother to mention that to your doctor because you're like, well, this is how you feel when you're 40. This is how you feel when you're 50. And I'm like, No, not so much. Not so much.
Good. We need to hear that. No, not so much, y'all.
No, not okay.
Not okay. Let's not normalize that pain and suffering is a part of getting older. And I think that is a huge stigma that this book flips on its head and has us think about. And that's where I want to go next. As we close out our conversation with you, I want to talk about denormalizing suffering, one, and the way you talk about this is this new concept to me called health span, how we should be preventative and caring about our health span versus our lifespan. So I want to come back and talk a little bit about that concept and how that relates to the overall theme of this book, Grown Woman Talk. So more to come with Dr. Sharon as we discuss about our health spans and how to improve them.